Hello and welcome back to LTC Heroes Live by Experience Care. My name is Peter Murphy-Lewis. I'm your host. I'm at the Wisconsin Healthcare Convention, and last night I had the pleasure of meeting Toni Kettner. She is the Quality Improvement Advisor at Superior Health Quality Alliance. Toni, welcome to the program.
Thank you so much for having me. I'm excited to do this.
So, Toni, I'm going to put you on the spot because yesterday I was at cocktail hour, I was having some nachos, and someone came over to me and she goes, "You got to meet Toni. Toni's got to be on this program." Tell me why you're well known in long-term care at this convention. How long have you been in long-term care? How long have you been coming to the Wisconsin Convention?
Okay, well, I've been in long-term care for a very long time, so long I won't even say how many years. I started out as a nursing assistant, and I'm a registered nurse and went on to get some additional education. I've been a director of nursing and an administrator in long-term care, and as you said, currently I'm a quality improvement specialist with Superior Health. I have been doing that role for about 7 or 8 years now, and coming to these conventions for a long time. First as a director of nursing and administrator, and now in my role. And it's just a great time. You get to meet so many wonderful people. You get to hear about all the cool things you're doing. We get to support them because that's what Superior Health is all about doing.
Is there anything you haven't done in long-term care?
I have not done maintenance, but I've helped out in the dietary department and laundry and housekeeping, and but maintenance is a little out of my comfort zone.
I always like to ask people what's their favorite part of their job, and I phrase it in the following way. If your boss came to you tomorrow and said, "Toni, we have to cut back your time. We got some shortage. For the next 6 months, I only want you to work 4 days." And you would say, "You know what? This part of the job is so great, I'll do it for free. I'll come in the 5th day." What is that part of the job that you love?
I think it's being able, having the honor and the privilege to work with the nursing home organizations, not only in the state of Wisconsin, but also in Minnesota and in Michigan, because we support them. I support them in all 3 states. It's knowing, hearing their stories. And then being able to try to help support them in quality improvement processes in whatever way we possibly can, so that they don't feel like they're alone. We develop lots of tools and resources, and we have a whole team of quality improvement advisors that's really there to support the nursing homes. And as a QIO, we're not regulatory. We're kind of like Switzerland, I always say. And so, we're kind of a trusted sort of advisor kind of capacity, and I think that's what I love, is just the people that I get to work with. Not only the people in the nursing homes, but just some of the lovely quality improvement advisors that I get to work with on an everyday basis.
So you know, because before we went live, you said, "I heard you're a CNA." So I'm a CNA and I'm a podcaster. I don't really understand what a quality improvement advisor does. Could you explain it in layman's terms for a boy from Kansas?
Sure. So let me, if I could just back up a minute. So as I indicated, I work for Superior Health, which is a quality improvement organization. And quality improvement organizations are actually funded by the Centers for Medicare and Medicaid. And we work to help achieve broad quality aims that CMS sets forth. And so I work strictly with pretty much the nursing homes, although I do get to engage with community health partners as well. So some assisted living, some hospitals, home health agencies, that kind of thing. And we're all about supporting them in their quality improvement journeys. So right now, one of the things that we're doing is we are supporting them with emergency preparedness. It's something very important. Everybody needs to have an emergency preparedness plan. We know that from COVID. And so we're working hard by developing series with some subject matter experts that we have to be able to really educate the nursing homes about what their emergency preparedness plans should be, what they should look like, how to integrate things like health literacy into those kinds of things. And we do a lot of other things. We help with infection prevention and control. We help support immunization, so increasing immunizations for residents and staff. And again, it's all about quality and safety.
Tell me about the community here at the convention. Why do you come here? What are the things that you're learning? Do you come here for the trends? Do you come here to understand what's coming with legislation? What conversations you have in the hallway that you're going to take home to your team?
Sure. So we come for all those reasons. I think it's important for us to be able to help people. We need to know like where they're at and what challenges and barriers they're facing, and also what's going well with them. And so being able to network, we always usually have a booth when we come. And so again, we're supporting the resources that we have, making sure people are aware of them. And the cool thing about a QIO is all of our resources are free. Like, where else are you going to go that you get that kind of opportunity? And so it's just it gets our name out there. Again, I learn about people's journeys. I learn, I attended different sessions like the one this morning where we heard about the kind of legislative things that are happening, and all that's important because you really need a bigger perspective to be able, I think, to really fully understand, and then that helps me in my role as well.
Toni, I want to ask you about some of the mentors that taught you about long-term care, how to deliver great care. Going back to as you moved up from CNA all the way up to advisor today, who are some of the people that taught you how to think, how to analyze, and how to make care different?
Sure. So I think I've had a lot of mentors along the way, but I think actually I would say that I was fortunate enough to know some really wonderful nursing assistants and some really wonderful registered and licensed professional nurses. And I think I learned the most from them, about what care in the nursing home and long-term care was all about. And just the wealth and the breadth of the knowledge that they bring. They're at the bedside, they're doing the care. And so that really helped me understand my role as a director of nursing and administrator to be able to support them.
Toni, my last question for you as we start to wrap up, and I think anybody who didn't know you before this interview and is watching you, they're going to say, where does she get her enthusiasm, your optimism?
I guess I'm just passionate about what I do. Sometimes I think I'm too much of like a cheerleader, but it's really all about helping people, and I want to help people in the best way that I possibly can. So that's an answer in a nutshell.
It works. Toni, thank you for joining LTC Heroes. It's a pleasure to meet you at the Wisconsin Healthcare Association. Hopefully see you next year.
Awesome. Thanks for having me.